Today we will discuss the nutritional approaches to managing type 2 diabetes and insulin resistance. What exactly is diabetes? Diabetes is a disease that occurs when the amount of glucose or sugar in our blood gets too high. This is glucose. It's a sugar molecule that comes mostly from the foods that we eat. Glucose is the main source of our body's energy. The pancreas is responsible for making a molecule called insulin. Insulin helps glucose, or the sugars that we get from eating food, get into our cells. With the help of insulin, glucose enters through our cells through these glucose transporters, and once glucose enters into our cells, it can then be used for energy to help us with daily functions for living. But what happens when we can't produce enough insulin or we produce none at all? Let's take a look at the pancreas where insulin is made. Diabetes affects the amount of insulin hormone present within our bodies. In type 1 diabetes, our body's immune system destroys the cells in our pancreas, and this means that our body can no longer make the insulin that we need to live daily. In type 2 diabetes, either our body doesn't use insulin well or the pancreas makes some insulin, but not enough to carry sufficient glucose into our cells. This in turn results in the buildup of glucose in our bloodstream. Either way, we need to make up the difference by taking insulin or other diabetes medications to control our blood sugar. In either types of diabetes, glucose levels in the blood can get too high, which can lead to significant health problems. This can include things like cardiovascular disease, kidney disease, diabetic neuropathy, or blindness. Though diabetes is serious, it can be managed with nutrition in the aid of a glucometer to help determine what our A1C levels are to track our average blood glucose, so that it's less likely to cause health problems. An A1C level at 5.6 or below is normal, but an A1C at 6.5 or above signifies diabetes. To achieve target levels, it's important to take our prescribed medication, to make healthy food choices, to participate in daily activities, to manage our blood pressure and cholesterol, and to quit smoking. As for dietary recommendations, the distribution of foods on our plate should include carbohydrates, proteins, and fats. The carbohydrates on our plate should consist of complex carbs, things like whole grains and veggies that have a low glycemic index. It's also important to consume carbs that have a lot of fiber. Carbohydrate counting is a common strategy used by patients to help track their daily carb intake. A typical carb serving contains about 15 grams of carbohydrates. The proteins on our plate should consist about 15 to 30% of our daily caloric intake. This can include things like chicken, fish, and tofu. And lastly, the fat present on our plate should emphasize healthy fats, things such as olive oil, nuts, and avocados. It's also important to limit the amount of saturated and trans fats that can contribute to insulin resistance. Nutritional tools for diabetes management can include the plate method, as we just discussed. It's also helpful to encourage patients to understand how to read food labels to better assess carbohydrate content, fiber, and added sugars in a given meal. And lastly, food lists can help individualize meal plans to help with carb counting. So pictured here is a menu provided at the hospital that I work at that's provided to patients with diabetes. Let's take a closer look at this menu. So this menu does a good job at helping patients follow a consistent carb diet. It incorporates fruits, vegetables, whole grains, lean meats, low-fat dairy products, and limits the sodium intake. So for example, if I were a patient that was using the carb counting strategy, I would remember that a typical carb serving contains about 15 grams of carbohydrates. So for breakfast, I could choose something like eggs, sausage, and French toast. And for lunch or dinner, I could choose salmon, broccoli, cauliflower rice, and Caesar salad. This approach helps individuals better manage their insulin dosing and assess what their blood glucose levels might look like after a meal. So overall, managing type 2 diabetes and insulin resistance through proper nutrition is essential for improving the metabolic control to reduce health complications and enhance the quality of life. Using the information provided in this presentation, healthcare professionals, patients, and caregivers are equipped with the knowledge, resources, and tools necessary to make informed decisions about the food choices to help manage their diabetes effectively through nutrition.